1M 2030 Youth, Technology, and Health Conference, Accelerating South Africa's COVID-19 Response. Next slide. My name is Alexander Taylor. I am the president and founder of Artem NextGen and the youth ambassador to the Global Challenges Forum Foundation. I am also the business development ambassador of the 1M 2030 movement, which represents 1 million youth leaders beyond 2030 and in context to addressing UN Sustainable Development Goals. Next slide. We have some expert panelists to converse with you about today that are developing a quantity of solutions towards quality problems. We will be going directly to having some of our executive panelists first, and then we will move towards our moderated panel conversation, in which we'll be featuring influencers throughout the South African region. We will then conclude with a Q&A discussion that incorporates you as part of our audience. So be sure to type in questions on our chat and share with us what your thoughts are so we can add those and contribute them into our conversation. Next slide. Without further ado, I'd like to introduce Dr. Jeff Ibbotson, the founder and executive lead of the Global Surgery Foundation in partnership with UNITAR.
Thank you very much, Alexander. I hope everyone can hear me well. And welcome from Geneva, Switzerland, and from the Global Surgery Foundation based here in the United Nations Institute for Institute for Training and Research. It's our pleasure to be hosting this webinar and really bringing in the topic of youth engagement in this whole situation. Next slide, please. What I'd like to talk about, not so much about the app and the tool itself, but just a little bit background of why we wanted to get started on this. We have some strong connections with South Africa, and one of our speakers, Dr. Slalom Maswini, will be joining us right after my little presentation. And we thought, how are we going to help the situation? And as you have seen, COVID has impacted the entire globe, and we haven't seen something like this in modern human history, really since the last 100 years, since the Spanish flu. Next slide, please. And although there's a lot of countries giving good data, and we got the great news just this week that New Zealand now has no active cases, we are not over this. And you can see the United States, United Kingdom, France, and Italy, which have been very hard hit, are on the downslide. But we see other countries like Brazil, India, and some of the African countries, and I've obviously pointed out South Africa, are still on the climb. So we have a lot left to do. Next slide, please. And in looking at this, when we think about it, we are in a new generation, a generation which has data and communications like never before in human history. And so to use this kind of resource and data communication is paramount in making a difference. And this is what will make the difference when we compare to situations like the Spanish flu 100 years ago. But we also have to reach out to those people in our global community who are at the greatest risk of being left behind. And those are people you all know about who don't have the resources, who are out in the rural areas. And in particular, they don't have high bandwidth, great access to data. They don't have maybe great access to communications, and the resources in some of these countries are very limited. So we need to be able to target the limited resources as best possible to help the governments do this. And next slide, please. And I think that giving this, this challenge over to the youth are the next generation. And really, and particularly in Africa, this, I believe, is going to make the biggest difference in helping the governments move these things forward, because we want to have a good legacy, a good heritage moving into the future. So what do we need? What is the challenge for you as a community? It's we need to start identifying potential hotspots of COVID before they arise. to help support all of the stakeholders who are trying to help this situation and focus limited resources through accurate data and predictive modeling and work together. And then lastly, really the end goal is to save lives and to keep that economy going. Because if we can identify, track, do contact tracing, and be able to isolate where the outbreaks are, then in the end, we're going to save lives. And that's what it's all about. So whenever we talk about data and numbers, let's always remember that at the end of those data, the numbers are people, are human beings, and we can't forget that. So I'm not going to go into detail about the app itself because we've got much better experts like Bobby who can talk about this, but I just want to give an overview and a welcome from the United Nations and from the Global Surgery Foundation, and really put this challenge out for the youth to get involved in making a difference in moving forward and dealing with this pandemic. So Alexander, thank you very much, and thank you to the rest of the panelists for doing this webinar.
And thank you, Dr. Jeff. Next slide, please. So we would like to go ahead and provide a transition to Professor Slalom Mazwime, who is the head of the Global Surgery University of in the University of Cape Town, who is also the president of SACSS and has done a lot of great work in terms of tracking and also working with local and federal governments in context to this problem and challenge. So without further ado, Salome, welcome.
Thank you very much, and greetings from Cape Town. Also really excited to be part of this, and we'll just add a bit more on what Jeff has already said. And just, can you open up my slides? And that was just a bit of background on what I do. As he's already mentioned, I'm head of global surgery at UCT. I'm an obstetrician and gynecologist. And I think also important for today is being a World Economic Forum young scientist and appreciating the role that we can play as young people, as the youth, in providing solutions, not just for COVID, but for many other things as well. And so I'm gonna speak a bit more on the app, and just to elaborate on why we joined this and why we're part of this and fully support and believe in this. Next slide. And so just to just highlight and to remind everyone that COVID has really reshaped our lives, our world, and what we do, and it's going to reshape how we do things going forward. So it's important that we are part of finding solutions, but not just short-term solutions, long-term. And so in this process, a lot of us have had to learn new skills, learn new languages per se, and that has been part of what this experience has been. But it's all towards finding solutions and building an Africa in which we're able to create and find solutions for the problems that we have. Next slide. And so the app itself, it's a self-evaluation app, and I'm not going to go too much into the detail, but some of the things that, you know, apart from all the things that it assists with, the tracking, the controlling the spread of the disease, one of the things that we felt passionately about is having it in multiple languages. And so we looked at translating it into Xhosa, Zulu, the South African languages. And I think the big lesson in all of that is, you know, you wanted to reach the people, you wanted to have a far and wide reach. And so even thinking about translating it into different languages assists with that, because then it reaches people that would not necessarily have been able to read it or understand it. And as we look at the app, spreading to using the app in many African countries, I think that will be an important part of it, so that we tailor make it as well for each community as we work with different countries. And also the fact that it's low data, and so easily used, easily accessible. And those are just really the important things But I think with this app, it's the opportunity to identify hotspots, to trace, and also to identify safe zones. So, you know, I won't go, as I said, too much into the technicalities, but I just wanted to highlight that, you know, it's a huge collaboration between different stakeholders, and each stakeholder has brought something different. But I think as UCT, what we've tried to do is bring in, you know, what would make it Afrocentric, what would make it fit the South African population more, and tailor making and changing, adapting a few things so that it works well in our community and environment. And I think that can be done as well in other countries. And final slide. And so in the final slide, I've just put the URL if you want to look at the app, and just put, you know, how simple it looks and how easy it is to follow. And you might not see clearly, but also just the different languages, just to show how you can tailor make it, and if you want to come on and partner with us as a stakeholder as well. So in conclusion, really to say that it's so important that we don't wait for solutions to come from somewhere, but that we partner, we work with each other as young people trying to find solutions to COVID. We work with the technology, we adopt things so that it makes sense to our environment and to our context. Thank you very much.
And thank you very much, Professor Salome. We really appreciate all the input that you provided in terms of a scalable application. I encourage members of the audience to please go ahead and visit this website or save this information. It's very important that this data is collected so that way there can be a multiple outreach in terms of governments, NGOs, and others and more to address the types of challenges we're living in today. I'd also like to encourage members of the audience to please put in your thoughts and comments directly into our comments section. Feel free to share with us what your thoughts are, and we'll be sure to try to address some of those questions and comments later on during this discussion. I'd like to go ahead and make a transition, next slide, to an opening statement by Mr. Bobby Dugana, who is the principal of Slalom Consulting. Without further ado, Bobby, please go ahead.
Thank you. Thanks, Alexander. Next slide, please. Hi, everybody. My name is Bobby. I am the principal at Slalom Consulting. I lead the machine learning and data analytics team for the Toronto branch of Slalom Consulting. I've been in the data analytics field for roughly 10 years, in fact, more than 10 years now, straight out of university where I studied mathematics. I was actually born in Nepal, and currently I reside in Toronto. I've been living here for a while now, Drake's hometown. And I'm very honored to be here, and thank you very much for the opportunity. Next slide, please. So I know Salome talked a little bit about the application itself. What I'd like to talk about is a little bit about the application a little further in detail. So I've done a number of projects with a lot of different companies over my career, and very few actually come in comparison to what I've done here with UNITAR and Slalom together to build this application out. Namely because of the scale of the application, the complexity, and most importantly, the impact that the application can have. And I'm really excited about it. What you see here is an updated version of the application. So we've got the application where you have the ability for people who are literate and non-literate to use the app, because you've got iconography as a focus in the application. Now, it's the same website as the forgot the name of the website there that was shared earlier, but it's the same thing, but soon it will be updated to a newer version, and it'll be much better presentable and that kind of stuff. Now, in addition to the application itself, what we've built is a backend system, which is mostly a decision support system. And what it is a dashboard that allows decision makers and policymakers and people like Dr. Jeff Ibbotson here to really advise governments on how to go about tackling the COVID problem. Now, next slide, please. What you see here is a sample screenshot of some of the panels from the application. You have the ability to track the disease and predict cases and deaths as time goes on. You also have the ability to track hotspots, like Dr. Jeff Ibbotson earlier alluded to. And the right-hand side is actually the first iteration of people using the application. We've got hundreds of responses already in the application. The data is already flowing in, and we've already started to collect the data from the application. And we're really excited about, seeing where this application can go from here. So, thumbs up on sharing the link there earlier. And please go to the website. Please share how you're feeling. If you're feeling sick, please do that. We would love to see those responses flowing in. Now, after this, what I want to talk a little bit about, because the topic of the conversation today is how the youth can help tackle COVID. If you can go to the next slide, please. What I want to do now is talk really about a few things that I think is something the youth can really help with when it comes to tackling COVID. The first thing I think the youth can be really useful and really use your strength and power to is help tackle misinformation. And there's a lot of misinformation out there on the web, on the internet, everywhere. And there's, people sharing things on the internet. And these are some of the clippings from various websites and blogs from all over the internet, right? From South Africa, from Canada itself, where about half the people believe in some kind of pseudoscience or misinformation, right? So it's not just South Africa, it's out here in the developed world, right? People believe in all kinds of things that are probably not true. And so what you can do is fight this misinformation in your communities. These are probably people people who you relate to, your aunties and uncles who come to you and say, hey, there's this amazing drink that I found that can help prevent COVID. So help tackle that. We really need your help to fight this because these people are in your communities and your voice, your strong voice is really needed at the moment. The next slide, please. The next thing we need to help with is data. Initially, when COVID started, we didn't have a lot of data and people were asking for data. Now what we have is we have too much data, right? And there's way too much information out there and it's really hard to analyze this information. I know Dr. Jeff Ibbotson shared a slide like this earlier today. In fact, it was the same slide from the same website, but really context matters. How you're looking at charts, how you're looking at data, how you're analyzing it, and how you're interpreting it, and who's interpreting it is really, really important. So making sure, we don't act as experts when we're really not is really important. Okay, so if we go to the next slide. So what do you do about the data, right? Where do the youth come in and how can you help with this data issue is, first of all, collect the right type of data, right? So when building the application, one of the challenges we found was we just don't have the right type of data. Now, this isn't complex data or big data. This is simply very easy information such as hospital data, how much ventilators do you have, how many beds you have, how many staff at hand, and how this data has changed over time, over days, over weeks. That's the kind of stuff we really need to help make the applications we've built more effective or any other application for that matter, right? So help collect open data, right? Reach out to people in your community, act as leaders to build open data platforms. And, you don't have to go out and build your own applications. There are plenty of open source applications available that you can just leverage. So you don't need to be a web developer or a programmer to be involved in this. And the most important thing, right, is to have experts make the decisions at the end of the day, is to not become armchair epidemiologists, not to become armchair doctors, and not start predicting things when you can't. And that's something that we at Slalom have been very careful about when we were building this application with UNITAR to make sure that we get constant feedback from Dr. Jeff Ibbotson, from Dr. Babab, and others who are experts in this field so we can really build a robust decision-making tool. And the next slide, please. And I think the last thing, where the youth can be really, really helpful, and this is something that the UN put out as, it's called the shadow epidemic. Okay, and I think this is something that is even more important than COVID because this is an epidemic that is going on for hundreds and thousands of years, which is really abuse against women and children, right? Whether or not you have COVID, you've seen, as you can see from the statistics here, that violence against women has increased significantly, even in the developed countries. Right? So we need to be very cognizant, we need to be very thoughtful about how we think through problems when it comes to COVID or non-COVID problems, right? As you can see here, there's 30% increase in helplines in developed countries like Singapore, right, against violence against women. So we really need to be careful about how we treat women because if you go to the next slide, you notice that, this is just a sample data set that shows, and this is again from the UN, the economic impact that women have. A lot of the data that comes in around, GDPs and quantitative numbers and financial statements, none of that really includes the value that women have in the world economy because these numbers are not counted for. these numbers don't appear in the balance sheets, these numbers don't appear in the GDP. So when we're thinking about solving problems related to COVID, we should really be thinking about and putting women front and center of this, because, you know, there really are, you know, there's a lot of issues around violence around women in the post-COVID and pre-COVID world. And I would urge everybody, all the youth, to really think about this problem and help tackle this problem. So these are some of my 2 cents. Thank you very much for the opportunity to talk. I'm happy to stick around to answer more questions about the application itself. And I will switch it off to you, Alexander. Thank you.
And thank you, Bobby. A lot of very rich insight regarding both the challenges that are being tackled by this application, as well as other challenges that are being faced. That goes ahead and concludes our opening statements. With that, we have a kind of a quote here that the secret to success is to offend the greatest number of people. And we would like to go ahead and transition towards a moderated panel discussion. And this kind of highlights what 1M 2030 is oriented about, which is trying to engage and empower youth entrepreneurs and give them a platform in order to address global challenges. So we're going to move towards our moderated panel discussion and start off with Mr. Subu Mumbaza, who is a digital entrepreneur and TV presenter on Real Gobazi. He's also one of the top 200 young South Africans. So without further ado, Mr. Subu, welcome. And we look forward to hearing all the input that you have to share with that. Mr. Subu,
thank you very much for having me.
Brilliant.
Thank you. Thank you for the invite. I feel very honored to be here and to be given the opportunity to talk to everybody about what I do and what I think about the topic. And just a short introduction from my side. Like they said, Sibu Mbanza, I'm 25 years old, and I'm a digital entrepreneur living in Johannesburg, South Africa. And I've been doing digital entrepreneurship for a couple of years. It all started as like a hobby, creating YouTube videos while I was studying, interestingly enough, at the University of Cape Town. I started it in my 2nd year when I was just, you know, doing terribly at school. And so I found that I really, really enjoyed watching YouTube content. And at the time, YouTube was, you know, specifically just for, well, a lot of the majority of the people who were on YouTube were either from the States or from Europe. That's the only type of content I saw. And so at the time I was like, I really would like to create content that South Africans can enjoy, that South Africans can understand, and sort of tell our own stories. And that's why I decided to start a YouTube channel, which then became a full-time career. And right now I have my own company, the Mbanza Network, which focuses on helping YouTube content creators here in South Africa and allowing them the space to be able to have careers in the digital space, because I think most of us would know that the digital space is not a huge one in South Africa yet, especially with our issues with internet and our high prices of data. But a lot of people are getting into it now. A lot of young people who had no other sort of ways of having a career are able to now because of the space. A lot of people who wouldn't have been able to, you know, become something that you would have to study at university are now finding ways to lead full careers, having their own apartments, their own cars, being able to help their families with this job that didn't exist, you know, 5 to 10 years ago. So that's what I do, and I manage a few other YouTubers and work in the consulting space also for brands in South Africa who want to work with young people of color here in South Africa to market their businesses, their ideas, their projects. So that's the basis of what I do. And right now, my focus has been to, I like what Bobby Dungana said about, you know, tackling misinformation, because I think that's a big part of what happens here in South Africa with a lot of things, and especially now during COVID. And I think my focus with my platforms was to make sure that there wasn't misinformation. And a lot of times, you know, I wouldn't necessarily have that information, but being able to tell people where to go is something that I can do. And I think that's the great thing about this application now, is being able to say, okay, I don't have all the answers, but here's where you can go to understand more. And another part of this that I've been focusing on is the mental health side of things. A lot of the healthcare professionals are very focused on the physical side of things, because that's what's going on right now. But my focus a lot of the time has been the mental health of young people here in South Africa, especially during the lockdown. It's a tough time. People have been, some people had to leave varsity, and that's their only places, that's their only home. They had to go. Some people are homeless now, young people like me. And so I just wanted to have a platform where I also spoke about the mental health side, because I think people, especially South Africans and South African men, tend not to talk about the mental health issues that are faced with times like these. So that was a big focus for me, was talking about mental health, letting people know that, during lockdown, it's not just a time where everybody can relax, sit at home and everybody's fine. Like, there's no issues. It's a time where people are really, really struggling, not just with the physical side of things, but just the emotional side of being at home. Recently, I was speaking to people who, find solace in being at varsities, find solace in being at work, because home is not that great, but now they're stuck, sometimes around people who are abusive towards them. So a big part of what I've been focusing on right now during the lockdown, during COVID, is just making sure that people understand that their mental health is as important as their physical health. Everybody's being told to wash their hands, but not so much to just, take a breath every now and then. So that's been where my focus has been. And yeah, I'm really excited to be here. I love what we're doing. I love this idea of the application, and especially because, it also comes from the university that I dropped out, but that I went to for a couple of years. So yeah, that's great. Thank you for having me.
And thank you very much. I think it's a great reminder that social distancing does not mean social disconnecting, and a lot of really good, interesting topics brought up. So with that, thank you, Mr. Siwu. We'd like to go ahead and move forward to Dr. Shakira Shanura, who is the Woman of the Year in Health in South Africa. So please go ahead and take it away.
So good afternoon, everyone. Well, at least for those of us in the same time zone, it's lovely to be here and kick off this webinar series, or this webinar around the application with you. I'm going to dive right into it. And, if you could go to my next slide while I speak. Essentially, I want to bring what it really means to be a young person, what the public health perspective is. So it's not just about COVID, it's the intersectional health issues and the health issues which have to continue. And then giving some food for thought, building on previous speakers, which talked a little bit about essentially, how do we ensure that young people take the fight forward? So just to make sure that we're all on the same page, and I'll take you through a few, I guess, boring compared to Siwu when you compare, but I think very important is we're looking at really what's the impact of technology during this time, and how's it linked to the different SDGs, and why we actually did a survey a while back, and it found that the intersectionality between health and ICT is close to 70%. And I see they've just brought up the questions, which you're free to answer on the screen as I go forward. And again, when we're looking at digital health, what are the different perspectives we're looking at? And it's really great to see that this app is considering hotspots. It's looking at how can we advise decision makers, but other elements that we also need to consider is the patient. How do we feed information to the patient? But as patients ourselves, how do we absorb this information when we Google our symptoms? But also, what do we do with this information? The digital space is great because I think it also offers a means for us to manage the healthcare system. For example, electronic patient records, which we're really struggling with in South Africa at the moment. And that's one of our key focus areas in the country. Another aspect which is being being used massively is training and capacity building. So how do we use the digital space for that, essentially? I see that the poll of different questions is still up. And if you'd like to answer, just give a click as we go forward. But I'll continue speaking to this. I then wanted to bring up a few statistics on, what's really hindering our access as young people to this digital space. And UNICEF has a children's report, and I think this report is so powerful because it draws on young people's voices themselves. And it's the typical issues which come up. Lack of internet connectivity, the cost is an absolutely massive factor. And then also what's the type of device that you're using. For those who are in the younger age group, and it's very important that we don't think of young people as one big group, some are hindered in terms of how their parents, for example, manage their time on technology. So there's different elements for us to continue to consider. Next slide, please. So what are some of the top health issues? And I think the previous panelist, Sibu, spoke a little bit about it. When we look at the Global Youth Wellbeing Index, it brings together some interesting components that we don't really look at. And during COVID-19, there's been a lot of talk about mental health. But in 2017 already, this index found, and South Africa was one of the countries where young people participated in the index. And about 47% of young South Africans said that they feel stressed. One of the primary reasons for this was not being employed. We have over a 50% unemployment rate in the country, set to worsen under COVID-19. Other aspects touching on gender, the adolescent fertility rate. So during this time, what we're seeing is that young women are having barriers to access their contraceptives or go and report gender-based violence. These are some issues which were already previously there, and now they're going to be exacerbated. Other issues, for example, are self-harm, the amount of suicide, again, all linked to stress. So even though South Africa has a high burden of HIV and NCDs, we need to consider these elements within a youth response, I suppose, to COVID-19. Next slide, please. So, this was me just bringing Star Wars in and the dark side. But I think when we talk about technology, we always look at it as an opportunity, and indeed it is. But there's a dark side to it, essentially. And both these reports that I touched on, the Global Wellbeing Index, but also the UNICEF report on children, where children themselves say too much of screen time is simply not good for us. It also means that you see my poll questions coming up, which I'll refer to just now. It also talks about limited physical activity, so linked to screen time, the effect on your eyes, for example. During COVID-19, all day we're staring at a screen. In the evening, we're interacting with family on the screen. What does this mean for eye health? And then very important is within the digital space, that that vulnerability to criminals, but also cyberbullying. We know that many schools are now going online, and what does this mean for peer interaction? So some of these issues and elements in digital health have to be considered. I'm quickly going to refer to my poll because all of you are listening in, and thanks for answering. It's brilliant to see that some of you are saying that, we have about 67% believe that technology can be used for social change. I believe that's the point of it. How many additional hours? Geez, everyone listening in has spent 8+ hours or more during COVID-19 using technology in addition to what they usually use. The lack of quality of internet and the cost, again, is an issue. And super, super interesting is that WhatsApp is one of the biggest platforms in South Africa. And that correlates to some of the data out there. Next slide. So as I said, I really wanted to bring in the health component and the public health component to this. It's great that an app is being launched, but we also need to think of South Africa's digital health strategy and how does it fit into this. And South Africa has a few key applications for public health. The one is called Mum Connect. We've got about 1.5 million pregnant women who receive messages during their pregnancy as part of their care. We've got BeWise, which I must be honest, I don't use myself, but it gives you access as a young person to medical care. And then Nurse Connect, as I said earlier, it talks a little bit about how nurses, for example, can connect with each other, talk about working hours, share ideas on what they're facing at the front line. Very interesting and important, and possibly an advocacy point, is that there is not a single mention of young people in the strategy. So that's the advocate in me coming out. Next slide. So I want to end off with one or two key things, and working in this space at the moment, especially in the civil society space. You know, when we were posed earlier, or the question was posed earlier, how do we ensure that we as young people drive change? And we as young people essentially live, eat and breathe social media, and this is where we tailor our campaigns, whether it's a campaign against gender-based violence or whether it's Black Lives Matter. Anything that trends will get stakeholder attention, and I think that's something that's key within COVID-19. How do we push the trends for social justice issues? Next slide. So a bit of food for thought. How do we also tailor our digital campaigns to leverage what's going on in the country? And those of you listening in from outside of South Africa, about a year ago, young teenage schoolboys went to a supermarket or a place known as Woolworths, and they drank water. And this trended massively within a day or two. And for me, I felt that the civil society space or the health space didn't make use of this campaign. They could have pushed, for example, you know, drink water versus alcohol, or let's not get into that debate, but also healthy eating, healthy living. So how do we tailor our digital space to digital change, I guess? I think there's a final slide from my side. Next slide. I wanted to end off with this because, you know, there's in The Tipping Point, the book called The Tipping Point, there's something called a stickiness factor. And for me, something that's really stuck with me this past year is this quote that I read in the Adolescent Health Report. And I think this is essentially where we're going. While yes, this is an important critical app during COVID-19, what is all this leading to? It's how are we including or increasing coverage to healthcare? And essentially what this means, as this young lad quoted in the report, is I want my healthcare to be a click away from me. So how do, during this pandemic, how do we fix our health systems, but also how do we revolutionize it, I guess? And I'll end up there. Thanks very much, and catch you, I suppose, in the question and answer session.
Thank you very much for the novel and brilliant insights and sharing them with us. Brought about a lot of different ideas and topics. I'd like to also thank the audience for all their amazing questions and answers. And our panelists are practically competing over what questions to answer to you. So feel free to continue adding some more. I've included some for our future Q&A and discussion as well. Some of them will be answered directly by panelists. Some of them will be answered during discussion. So thank you all very much for that. As well as feel free to share your thoughts on social media as well. So if you tag in the hashtag 1M2030 and go on Twitter, on Instagram, we'll definitely be looking at some of the comments and thoughts of what you guys thought about this discussion so far and ongoing. So moving forward, I would like to introduce Mr. Dennis Ngangu, who is a digital entrepreneur. He's also a 40 under 40 in terms of African business, and he's also within the business elites for Africa. So without further ado, welcome, Mr. Dennis. We look forward to hearing what you have to share with us today.
Thank you so much. It's really exciting conversation, and it's really awesome just to be a part of some of the insights that even Sibu and Shakira were able to share. As he mentioned, my name is Dennis Ngango, and as you can see on the current slide, sorry, I have a 9 to 5 as well. So I work as an industrial engineer, and my main responsibilities is really being a business analyst and a system developer for a leading medical group in Pretoria, South Africa. On the side, I also run Defining Media, which is a digital media startup aimed at empowering South Africa's youth through compelling, creative, and wholesome storytelling. Over the last year, since we started the platform, it has amassed over 50,000 subscribers and been viewed over 3 million times. When it comes to the role that we've been playing in COVID, I think the one side is definitely from the storytelling point of view, in the sense that we were lucky to collaborate with one of the other panelists, Naledi Radebe. She's coming up after me. We were able to share some of her story on our platform, just so that young South Africans could really just relate to someone that they know. I think for a very long time, in between a lot of the misinformation, there was a lot of ideas that it wouldn't impact us as Black people or us as Africans the same way that it would impact people throughout the rest of the world. So being able to collaborate with Naledi was such a big thing for us, being able to just share a story that people can relate to, and also have the right insight to make the right changes that they can make from their very own homes. Speaking of things that people can do from their very own homes, as an industrial engineer for the company that I work for, one of my big responsibilities, as I mentioned, is being a system developer. And that required me developing systems and tools that the employees at our company can use during lockdown. So we had to develop new systems, new solutions, be quite innovative with what we expect from our employees while they are at home, and also being able to get the necessary insight to see how exactly they have been performing in terms of productivity as well for my employers. So that's also been quite an interesting way that I've been involved in COVID and developing solutions that will be innovative for the workspace as well. I think one thing that all of us are really mentioning is that it's really become a priority for not only young people to, have digitalization as one of their skills, but everyone in the workforce. It's also showed how businesses need to be able to adapt to what's happening in the world. I think for a very long time, people in the world, or rather people in business, were functioning in just their industry and not really looking at what's happening in the outside world. And now with COVID, it's really pushed businesses to make sure that they are always reacting to what's happening in the world, and make sure that they are practicing their societal responsibilities and obligations. So that's it from my side.
And thank you so much, Dennis. I especially like the note on encouraging best practices and corporate social responsibility at the end of that. So thank you very much. We appreciate your thoughts and display of information. We'd like to move forward to our final panelist before we enter our Q&A discussion. Ms. Nadili Radabi, who is a fashion and lifestyle influencer. She's been featured on My Coronavirus Story and is also specifically an ambassador in terms of higher health. One quick note before we move forward is she was one of the few influencers that after receiving coronavirus made a platform on trying to teach and empower other people on how to be aware of it. So without further ado, Ms. Nadeli, welcome. We look forward to hearing what you have to share with us today.
Hi everybody. Thanks so much for having me on the platform. Hi Dennis, we meet finally. So yes, my name is Naledi Radebe. I live in Johannesburg. I'm 29 years old and I am a fashion and lifestyle influencer. I was diagnosed with COVID, well, I'm now recovered, but I was diagnosed mid-March. It was really early at the time when it just happened. And I decided to share my story on my platform on Instagram. Unbeknownst to me, it would go viral and every single day I would be receiving 25 to 30 messages, direct messages from people who were curious to find out, more information on the subject, sharing their fears really about it. And I think kind of trying to get more information from somebody who had experienced it versus just the massive or influx of information that was coming at us at one point. So I decided to really focus my platform on providing as much as I could as I was going through my process of recovery. That also meant that I was talking a lot to media publications and national platforms. I decided to create or curate a series of conversations between me and medical professionals, because I'm very much aware of the fact that I'm not a doctor. I can only speak to my experience. And so I got, a psychologist, I got a doctor to kind of really give insight on to what was happening and what it feels like to also be experiencing the lockdown, the psychological effect of that as well. That and also collecting information from reputable sources and putting it in bite-sized highlighter pack on my page so that people can access it. This is when I got approached by Higher Health, who I am currently working with. And essentially who they are is an agency that works with the Department of Higher Education and Training, and they provide support, both physical and mental health and well-being for students within our higher education institutions. And I thought to myself, you know what, I was a graduate at UCT not so long ago. This might be a really great opportunity to collaborate, especially given the fact that the profile of my following is quite young and youthful. So I think also going into this entire thing, I was very aware of the fact that we have Africa is the highest concentration of young people, or has the highest concentration of young people in terms of the continent and age demographic. And when you're looking at us, we're probably going to be the most mobile and therefore move COVID-19, the virus. And not only that, but we will be asymptomatic carriers like I was. And so there needs to be the right kind of information and the ways to be able to respond to the situation. I think it's also important to highlight that in South Africa, our households are made, or many of our African households are multi-generational households. And so you're going to have younger people that are going to be exposing older people who might maybe be at higher risk. And not only that, but there's a prevalence of course, AIDS, HIV, tuberculosis, diabetes, and these kinds of issues within the student or within the youth population and student population, and people who are immunosuppressed or have, one or two or more comorbidities kind of need the information at hand. And so accessibility to information becomes really important at this point, and kind of like getting rid of conspiracy, which I mean, if you live in South Africa, I'm sure you heard all sorts of conspiracies that floated around at the time. So working with Higher Health, and in response to the fact that we've moved to level 3 now, they've created a tool that I'll just briefly brush over. But essentially that tool is kind of like it checks, and it's a daily screening tool that across our universities, across 420 different campuses and 2 million students and staff will have to register for it. You will get, you can access from your phone, you can access from your laptop, and you get asked a series of questions, including the respective campus that you're going to be entering, your name. You answer those questions. It gives you a reading of either low, moderate, or high level risk reading. If you receive low, you are given clearance for 24 hours. And I think this is a great way to map COVID-19 within higher education institutions. And this information will be used as tracking info in conjunction with the Department of Health. And I think that's the most important thing, is the fact that, the information that's submitted is accurate, and that requires, us to be able, or younger people, students, the youth, to be able to really be self-aware and constantly engaging in how they feel and their health, and busting conspiracies and getting rid of stigma, and really sharing and updating the information, because everything is playing out in real time. And the best way to do that is by using platforms like social media and this given tool. Thank you.
And thank you very much, Nadeli. So with that, we would like to go ahead and move forward to our Q&A discussion. But before that, just take note of what's on the screen currently. Move a slide back for me, please. To access more information, please visit higherhealth.ac.za. To access this tool directly, please go on to the web link that's noted there. And please go ahead and follow their Facebook and Twitter page. We want to keep this conversation moving forward. This is a great discussion and we're bringing a lot of great people together, but it's important that we take this discussion and move forward with it, especially due to the work that our panelists and opening speakers have done regarding this. Next slide. So yes, so before we move to our Q&A discussion, I would like to encourage members of our audience here today to go and post what your thoughts are on hashtag 1M2030, hashtag Tech Tuesday. Be sure to follow us on our Twitter pages, on our Twitter page, our Instagram page, or register on our 1M2030 page to learn more information and to keep updated on what we're going to continue to do further. Moving forward, I'd like to go ahead and begin and initiate our Q&A discussion. So the first question we have here is posed to Jeff. So Jeff, the question is, how should the World Health Organization standards be reevaluated considering the lifestyle and multi-generational living proximity to the majority of South Africans?
Well, thanks, Alexander, and thank you to all the panelists. They're really good presentations. I've really enjoyed it. Wonderful. Well, whoever asked that question, wow, that is a loaded question. And I think that when you look at an organization like the WHO, they really do need to try to meet the needs of all countries, but at the same time, meet each country's individual needs. So the WHO as a global entity has its global standards, but each country has its own country office. Each region has its own regional office. And so each of those country offices for the WHO and the regional offices have to drill down and be a little bit more specific in what those needs are for each of those countries. And so addressing the like you say, the multi-generational living patterns of countries like South Africa, it's really needs to be dealt with in a much different way than, let's say, in North America or Europe, where we're not living in big family units. And so when you trickle down from the higher levels of headquarters to African regional offices to the country offices, that all needs to be taken into consideration and then be communicated out to the national ministries of health. So that sounds really super complicated. And that's why in the app that we've put, the self-reporting app, we actually have that as one of the questions. How many people are you living with? How many people over 65 are you living with? How many people who are vulnerable are you living with? So that we can start getting that data back to the Ministry of Health people so they can use that. Very good question, not a very easy answer. It's very complicated, but it has to be done on the front lines and country specific. I hope I've answered it in part.
Thank you very much. It looks like we had a comment from our Q&A on my end. It looks like I have mispronounced. I said Nadeli, and I should have said Nadali. So I apologize if there's any Nadeli. So I apologize if there's any mispronunciation there. Moving forward. So yeah, I appreciate that. Just making sure that I keep myself in check as well. You know, we all have to, uphold that. So I'd like to go ahead and look at the next question that's proposed to Bobby. So Bobby, can you tell us more about how the application that you made is unique to the South African people?
So there's a couple things that are unique about the application, mostly along the localization front, which is about the languages. So what we've done is we've made best efforts to make sure that we translate this application into all the various different languages spoken in South Africa, at least the majority ones. In addition to that, what we've done, given literacy standards in South Africa and in other countries, because remember, this application is really about making sure it's deployed globally as much as possible, right, to various different countries. So we've got a lot of iconography in the application. So even if it's used by people who may not, unfortunately, be able to read, they should still be able to use the application because there's icons indicating symptoms and whatnot. And that's really the unique factor, or the unique feature of this application.
Very, very, very
In
good.
addition to that, sorry, I also want to add, this application is low data, like Dr. Ibbotson has already alluded to, in that, you know, there's not a lot of image. In fact, there's very little images in this application. So even in areas where there's low data, you should still be able to use this application, even with, you know, non sort of modern day 4G internet connections.
And regarding the visual, like, aesthetics of it, where you were talking about how people don't necessarily need to speak a language, why is that so important, particularly in the communities you're outreaching to?
Well, it's important because we want to make sure we get as many responses as possible, especially from communities where literacy is at a low rate, right? Especially in those communities, I would say there is a bit of a more correlation for diseases to be more prevalent. So that's one of the reasons as well as to why we wanted to make sure we focus on iconography and less on, you know, text and whatnot.
All right, wonderful. We have a side question from an audience member. You said you grew up with Drake, so the question was, have you met him? So I'm gonna go ahead and allow that one. See if you could answer that for me.
So 3 weeks ago, before my wife delivered our first child, we were driving around our neighborhood and we actually drove past Drake's mansion. That's as close as I've gotten to visiting the god himself. He was the only one in the entire neighborhood with a security guard. I don't know why he needed that, but because it's Drake, he wanted to show off, I guess, and I fully approve it. That's it. I just saw the top of his house.
Well, we appreciate you for being a good sport. Thank you so much, Bobby. So moving on to our next questions. Oh yeah, so we had one let me review this real quick to make sure it's framed. Yeah, so we had one for Sibu. So what got you to consider the mental health factors regarding COVID-19? Because that's not something that's, you know, widely discussed.
Thank you for the question, first of all. So mental health is something that's always been part of the topics that I speak to my audience about. I have an audience of over 100,000 people, and mental health is something that I've always spoken about because it's something that I deal with. I was diagnosed with depression and anxiety from a very young age, so it was always going to be part of what I speak to my audience about. I'm very open on social media. I figured that if I can help even one person, let alone over 100,000 people, understand depression better, understand anxiety better, understand just mental health and the fact that it matters better, especially living in South Africa, where it's not really seen as a huge issue within our families. People sort of come up with alternative ideas of what is going on with you instead of it just being, you know, depression, which is something a lot of people have. And so I figured, you know what, during COVID-19, especially during the lockdown, a lot of people on my timeline were talking about how terrified they are of, you know, having to go back home, or terrified of, you know, the fact that they can't be at school, and they're worried that, is the school year going to carry on? Am I going to be able to graduate? Will I even get a job now? And so I thought it was very important to talk to people about that, because I am lucky enough to be in the space where nothing much changed. I'd always worked from home. I'm a YouTuber. I do literally, where I'm sitting right now is where I do my work most of the time. So there was no office that I had to leave. My cameras are here, my lights are here. So things were a little bit easier for me in that sense. But I did understand that a lot of people would feel out of place. A lot of people who can't even do their work from home because they just have to be in the office in order to do it. And so I thought it'd be important to talk to people about that. And also, I mean, we live in a very capitalistic world, and people feel like they need to be doing something all the time. And people felt like during lockdown, I need to be as busy as possible because I have all this free time now. And so I was noticing that a lot of young people were feeling very stressed about the fact that they weren't making use of the free time that they felt that they had. And I just wanted to make sure that people understood that it's a difficult time for everybody. And this is not necessarily free time. This is a very stressful time for people. And if you find yourself not doing anything on Monday and then only working on Tuesday, that's fine. And so, yeah, I thought that was very important because people don't have those conversations, especially in Black families and as young Black people. So I just wanted to make sure that people felt like they weren't alone. I think that's the biggest thing. We tend to feel like the things that we're experiencing them in a vacuum. We're the only person who's struggling to wake up in the morning, even though they can wake up at whatever time now. So yeah, that was very important for me. I understood that a lot of people would be scared of the physical side of COVID-19, but I think I also understood, even from my experiences, that the extended lockdown would be a huge issue on people's mental health. And so that's something that I really wanted to focus on. Yeah.
Wonderful. Thank you very much. We have a question proposed to Salome. So hospitals have been canceled in mass, in terms of services that have been canceled to patients that would be normally going due to COVID-19. So how would you prepare, how do you believe hospitals should deal with the resurgence of people that are re-entering in the healthcare system, especially given what was noted as a shortage of supplies?
Yeah, so I mean, it's really an important question, and it's not really something that I could address on my own. We've got national task teams looking at just trying to answer some of these questions. And so what's happening now is that, the COVID-19 patients, the numbers of patients with COVID-19 are increasing, and the number of patients coming from having other diseases are increasing, and also trauma-related injuries, etc., are also increasing. And it's a huge burden on the healthcare system right now. But, everyone is starting to work together, having conversations to find strategies, especially in areas where there are high concentrations of COVID-19 positive patients, So it's not something that I could answer on my own, but to say that there's a lot that's happening behind the scenes, and there's a lot of different committees, task teams looking at answers for this. There's also, from my end, it's patients whose surgeries have been delayed, but it's not as simple as, take them, start operating. Some will be at risk of getting COVID-19 in the process. And how do we mitigate, how do we navigate around this situation? So I think as healthcare workers, as policymakers, we all having conversations about this right now.
Understood. I know, Dr. Shakira, you actually expanded upon this a little bit in your presentation. I was wondering if you'd like to expand on that question as well from your perspective.
Sorry, could you just repeat the question quickly for me?
Oh, sure, not a problem. So it was regarding how hospitals have canceled a lot of their services due to a large influx of patients, and how should they readjust for people that are re-entering the health system in context to a shortage of supplies?
Yeah, the impact has been very significant. I've had a few patients calling me and telling me about their experiences. For example, one woman who suffers from stomach cancer needed to have a hysterectomy. And unfortunately, the public healthcare system would not accommodate her. She then couldn't afford private care, for example, and we had to try and do fundraising so that she could get the necessary services. Working in the HIV space, going back to contraception, but also ARVs, one of the biggest calls is to have a supply, a massive supply for patients, so a 3 or 4 month supply for patients of ARVs, so that they don't have to keep leaving their house to go and get chronic medication. So that's the one example. The other, I think, which is not explored, how do we start to deliver our medications to patients? Community health workers are already going to households. So I think we need to urgently look at how to keep our progress, but also our traction on current health services, which honestly has been disrupted at the moment.
Understood. Thank you. To Nadeli, is that correct? Perfect. I have a question for you. No? Yes?
Naledi
Okay.
Khatebe, Naledi, N-A-L-E-I, Naledi.
Excellent. Okay. So a question that was posed to you is, what is the responsibility of those with a platform to share that information with their stakeholders? And I guess I'll try to simplify that a little bit. Just like maybe, how did you feel when you had to share you tested positive? What did you feel it was your responsibility to share with your followers the importance of that and the safety measures that are required?
Thanks for that question. I think, yeah, for sure, it came down to considering that I had a platform and that I'd gone through experience, because I think information is so much, it's easier to consume information when it's someone that you can relate to, or someone whose experience you can kind of like, you can pinpoint how it works through their experience. And so I did feel very compelled to kind of step up and really, in a way, get rid of the stigma, because it's when we don't have conversations about things that we struggle to really deal with the issue at hand or understand what's going on. And so I really wanted it to come from me and say, okay, look, it's somebody that you kind of all know in a familiar type setting, and it's anyone is susceptible to it. And I do think that it is, of course, you don't want to pressure people and say, oh, you have to speak about your health. You don't have to, but I feel very compelled to share with people when it comes to something as big as a pandemic or a novel virus. The more information that we can share amongst each other, it's going to make it easier to deal with the situation at hand, I think.
Understood, and I appreciate the input for that. We have one posed to Dennis. How have you adapted the works of your business and organization to deal with this crisis? And what can I do as an entrepreneur?
Well, I think the main thing that we did first is look at what products and services we actually can offer. Because we are a company that requires that our patients, because it's in the medical industry, our patients actually come into the office and they use the machines that we use to test out whether they have a certain illness or not. So in that case, that business was already taken out. That portion of our business was taken out because people aren't able to, come into our offices. Everyone was on lockdown. So the first thing I would definitely recommend is look at your existing products and services. What can you still do? What can't you do? From there, identify what you can add to your existing products that still makes sense for your industry, still makes sense for what you do, and make it more applicable to the current situation that we're in. I say this because at the end of the day, people are always listening, and people will remember what you did during the season as well. So the moment you come back, especially as an entrepreneur, people will remember whether you actually contributed or whether you kept quiet. I do think, though, for other entrepreneurs, it is quite a challenging time. And that's why I'm actually so thankful for Sibu, who even brought the mental health component to the conversation, because finances is, of course, a big, big concern. It is something that affects all of us. I think the one thing that we did see with COVID is the fact that it doesn't discriminate. It impacts us all. So having said that, definitely look out for your mental health as well and see how you can contribute, and from a space where it will be healthy for you and it will be realistic, so that you'll be able to continue pushing as soon as this season is a bit more manageable and we're out of it.
Understood. Thank you very much, Dennis. We have a question for Bobby, who I guess is a very popular person today. How will data privacy be handled within the app?
So, yeah, I knew someone was going to ask that question. It's always the burning question these days anyway. So there's a bit of a trade-off, and I don't want you to be alarmed when I say that, when I say trade-off. One of the key components of this application is identifying hotspots and figuring out where people are responding to the app from. So the location component is important. So I'll get back to that in a bit, but first of all, there is no personal information collected. Your names aren't collected. That kind of stuff is not collected. What is collected is as part of any web application, whether you join Zoom, whether you go to Facebook, your IP address is always tracked. What we do is we anonymize that and we translate that into an approximate location on the map. Now, what we can also do on top of that is if we're deploying this application in regions and countries around the world where we feel like there is significant human rights violations and people have genuine concern for the safety and whatnot, so that, you know, there might be repercussions for, you know, people responding from a very low density area and you can be traced back to an individual. What we can do is we can mask the location even higher in a higher resolution, in a low resolution, so that you're looking at a 100-kilometer radius or a 10-kilometer radius or a 50-kilometer radius. So we have the ability to quickly pivot and layer those privacy filters so that, you know, people can be rest assured that, you know, their privacy is handled well. But in addition to that, there is no other personally identifiable information that's collected.
Understood. I'd like to go ahead and open up the floor to any opening speakers or panelists that may have either answered a question in the comments section that they'd like to shed to light, or have a particular piece of information that they feel like they want to shed light further upon. Very good. So with that, I would like to go ahead and conclude our Q&A discussion. I'd like to thank all the panelists and opening speakers for being here today, for sharing their insights and their thoughts, as well as the amazing work and high level of impact that they are developing and producing, especially within the South African region. So much appreciated, and thank you everyone for contributing and joining us today.